Welcome to The Conservative Edge. I'm Dr. Joe Corey, your host. This show will give you an edge on the truth. It's about substance on each and every issue. That's the way we do business here. We take an issue and we discuss it with depth and with responsibility. Therefore, we are dealing today with homelessness in as holistic and as specific fashion as one can. Our first guest is Mr. Eric Samuels. Eric, welcome. This is Eric Samuels, who is a noted expert on homelessness, at least in the state of Texas.
Thank you. Thanks for having me on.
I'm sure you read the Declaration of Independence of the United States. You're familiar with it, right?
Yes, I am.
Life, liberty, and the pursuit of happiness.
That's right.
And they also say that we are endowed by our Creator to enjoy all three. Is that correct?
Yes.
It is. It says that government was created in order to ensure that these things can in fact happen for every American. Are homeless people included in all of this?
They should be. They should be.
They should be.
And I think the government should, of course, play a part in that. I also think our communities and our systems outside of our governmental structure should play a part in that. I think, especially in Texas and probably many other states, our faith community, they play a big part in helping us to end homelessness, and we have other groups that do so as well.
Understood. So as a society, we don't have different classes like they do in some other countries, right? We are all Americans, we are all responsible for one another, and the government is responsible for all of us. Is that correct?
I mean, I would love for that to be the fact, yes. I mean, we do have different classes, of course, economically, but yes, we all are all Americans, and we are all living in the same communities and sharing the resources of those communities, no matter if we're housed or not.
Okay, and the homeless in America are entitled to no less than our respect and the full engagement of the government in solving their problems. Is that correct?
I mean, I believe so. Okay. I believe so, yes.
Let's talk about what is homelessness, just to make sure that the audience understand what we're talking about. We're talking about people living in shelters, people living in transitional housing, and people who are on the street. The visible part is those who are on the street. Right here, there is a certain section of Riverside, California, that has tents everywhere, dirt everywhere, neglect everywhere, and all types of people, from those who are just like you and me, but they happen to be homeless, to people who are seriously drug addicted or alcohol addicted. And I'm sure you have them in Texas, and they definitely exist in Los Angeles. So those who are living in public places, they are people who are living in the street. Is that correct?
That's correct. We do have that. In fact, right around the corner from our office, we have an encampment, just like you described in Riverside.
Now, when somebody is living on the street, he's creating some kind of his own homestead, in a sense that the street doesn't belong to him. It certainly does not belong to family, and even if it did, cannot occupy it anytime he wants. So when he takes over the portion of the street to put a tent, he is in fact intruding on public rights or private rights. Is that correct?
Well, it really depends on what the local laws say. I don't know if you heard, but here in Austin, we recently had a change to the ordinances that control public camping, lying and sleeping in public, and solicitation. And as long as an encampment is not in the public right-of-way or causing a disturbance or creating an unsafe situation, then that encampment is allowed to stay in that location. As long as it's not on private land, it is allowed to stay in that location.
So in terms of public land, he is allowed or she is allowed to pitch a tent, live in it, and how about controlling the conditions around that tent? For example, will they be able to use drugs? Do we look the other way when they use drugs or alcohol?
It would be no different than if I was on the sidewalk openly using drugs. I would, of course, be cited, and police would interact with me, and they would interact with someone who's not housed as well.
Are they responsible for the cleanliness of the place? Some of them literally go to the bathroom, right there, and instead of going to a safe place and a proper bathroom, so to speak. Is that?
Yeah, when we're talking about encampments, we are looking at a public health issue, and what you're talking about, that can, of course, be detrimental to the public health, and so those things do have to be addressed. We are doing a really unique thing in Austin where those that are living on the street, they now have a trash service. It's called the Violet Bag Program. So those on the street are able to they're able to put their trash in this violet bag, and it'll be picked up by the Department of Sanitation. So that's helping, but that is something we need to watch out for sure.
According to HUD, that's Housing and Urban Development, there are 700,000 individuals on any single night that could experience homelessness. Is that about the right number for you?
Yeah, that's about right. I mean, I think he's probably looking at the 2018 numbers, so that sounds about right. There are 26,000 people in Texas on any given night that are experiencing homelessness.
In Texas, in the whole state, 26,000. That's rather low by California standards.
By California standards, yes, but too high for us.
About half of the 700,000, Eric, are considered to be homeless. In other words, they are on the street. The others are in shelters. So it seems that there's a huge demand for shelters these days. Are we building enough, or whose responsibility is to build shelters?
Well, so I think in some communities there is a demand for shelters. We do need a safe place for people to be, especially if the weather is like it is in Riverside and Austin, where the heat is extreme and will result in someone having heat stroke. We definitely need more shelter to stabilize folks. But more than that, we need more housing, deeply affordable housing, supportive housing to get people out of homelessness and keep them out of homelessness. So we don't have people on the street or in these shelters.
23% of the homeless, that's 700,000, so we're talking about 150 or 160,000 people, are chronically homeless. Now what that means, the definition, just to make sure that our audience understand, they are homeless for a year or more, and they've had at least 4 episodes of homelessness in the last 3 years. Now those who are chronically homeless, do they get a priority when it comes to, for example, if new shelters are open up, will they get the first priority? Because I went to a shelter yesterday to see what happened physically. The lines are so long that if you are a newly homeless person, it's almost impossible to get into a shelter. But do the chronically homeless, do they get priorities when new shelters or new tent cities are built?
Well, yeah, it depends. But before I answer that, let me answer this, or let me go further into this.
Please.
You're right about the definition of chronically homeless in terms of duration of homelessness. But on top of that, they also have a disabling condition, such as serious mental illness, substance abuse issues, or physical disability.
That later. We understand that. But those who are chronically homeless could have been chronically homeless for all kinds of reasons that we will discuss in a moment. But do they get any special treatment so that we could deal with the backdrop of homelessness, so to speak?
Right. So in some communities, those folks that are in that position are considered the most vulnerable. So they will be prioritized higher. And yes, they would get into housing faster if housing is available. Unfortunately, in a lot of communities, it's not available. Okay. But yes, in a lot of communities, that is a population that's prioritized.
I understand that. Now let's look at about the ethnic groups that make up this population of homeless. 42% African American, 39% non-Hispanic white, 13% Hispanic, 4% Native American, and 2% Asian American. Why do you think the Asian American is such a small proportion of all of the homeless people?
Yeah, I don't have an answer to that question in particular, but one thing that is easy to see when you go through those statistics, people of color are disproportionately represented in the population experiencing homelessness. And that is glaringly apparent when you look at the statistics, and that's something that we need to address. And it's something that's concerning, I think, to anyone who does this work.
I would say the strength of the family unit among Asian families may explain a lot of that. And some of them looks at homelessness in a very different way than maybe other people do or other ethnic groups do, that it is a total shame for the whole family for somebody to be homeless. So they're trying to pull together resources to prevent homelessness. Would you think that this is a good idea?
Well, I would say the strength of family cuts across all races. And I think household by household, you'll have different beliefs about the reliance and the belief in family and the reluctance to let someone fall into homelessness or the ability to not let them fall into homelessness. But ultimately, I do believe that you're right, the support network is among the biggest contributors to keeping people housed, even when they become housing unstable.
The largest percentage of those who are sheltered, homeless but sheltered, are African American, but they're only 12% of the US population. So we have a serious problem right there that I think we need to deal with. Are you dealing with that in Texas? Is that any special program for special ethnic groups?
Well, so we are starting to look at the data to look at racial inequality in the homeless crisis response system. And we still need to look at the data and go into it deeper, but that is something that we're starting to look at because it's something that we have observed not only in Texas, but across the country.
That's correct.
There's a lot of inequity and we need to address that.
Is it inequity on the demand side or on the supply side? In other words, are we building homes that in fact exclude a large number of blacks, or because the demand by blacks is so high, or is it excluding them for anything that have to do with racism or anything like that? What's your experience?
Well, I think it's probably a little bit of both. I think that some of the housing that we are providing is not just one race, of course. It would be the housing that we're providing is not meeting the needs of the folks that are lower income, those that make about 25 to 35% of AMI. We don't have enough units. And oftentimes, though, our inequality or social inequality or socioeconomic inequality is aligned with race, and so that can correspond with what you're talking about. In terms of the opportunities that we're providing through our homeless crisis response system, such as moving people out of shelter and into permanent supportive housing, we're looking at that and seeing if we have inequities there. Early research shows that there may be some inequities there. So a person of color may not move out as fast as a white person, someone like me, would move out and into that permanent supportive housing.
In terms of gender, 63% are male, 37% are women. Many of these women are in the homeless population because of two major reasons, if I understand it correctly. One of them is, of course, abuse at home, and the second one is drug dependence. And they discovered in Chicago, I don't know whether this holds true for the whole country, that many of them have serious mental illness. In some of the people who go through the system in Chicago, 75% of the female who go through the system have some form of mental illness. What's your experience with that?
Well, I think a large proportion of women who fall into homelessness are victims of domestic violence. And once they fall into homelessness, they are open to even more trauma. And that trauma can often result in a reliance or dependence on substance abuse or substances. And also it can have a deteriorating effect on mental health. Of course, across the population experiencing homelessness, there's a certain percentage of those that are seriously mentally ill and a population that is abusing substances. I will say, though, that percentage is not that much higher than the overall percentage just within the United States among the general population. The difference is those folks that are housed, that are dealing with those issues, they have a stable housing situation and support network, whereas someone who's on the street, they don't.
At one very disturbing statistic, at least to me it is, these are people who defend our country, these are people who served in our military. Veterans, about 10% of all homeless people are veterans.
Right.
And the number is very large when you look at homeless veterans as percentage of the male population among the homelessness. The number is very large. There are specific programs that have been devised to stop homelessness among the veterans. What do you know about it?
Well, so a lot of communities across the country and in Texas have taken on the challenge. They call it Mayor's Challenge sometimes, Mayor's Challenge to End Veteran Homelessness. And through that, we have had 4 communities in Texas have effectively ended veteran homelessness: Austin, Houston, San Antonio, and most recently Abilene. And they've done this because they get their leaders behind this issue, their community behind this issue, their business leaders, landlords, and they coalesce and they collaborate on making this goal a reality, and they've been able to do that. We've decreased veteran homelessness in Texas by 12% over the past couple of years. It's not as quick of a reduction as we'd like to see, but we're making strides in that area. We have just under 2,000 veterans in shelter or on the street in Texas on any given day, and I really would like us to take up that challenge and just say we're just going to end it across the state.
Well, we hope it'll go down to 0, and I'm sure with your efforts we'll make better than 4% in the future. So there are 4 categories of homeless people, if I may. Those that are economically based homelessness, people who lose their job, they're unemployed, people who can no longer work, so you cannot afford the rent, you are unemployed, you end up in the streets. That's right. One pattern. The second one is medically induced schizophrenia, mental illness, chronic medical condition. And here I want to point out a very important nexus between the prison system and the healthcare system. What is happening here, and leading to homelessness, of course. The city of Chicago, the Mayor Rahm Emanuel, closed 6 of the 12 healthcare clinics. Now what happened? Those who used to go to the clinics stopped going to the clinics. They stopped getting their medicine. They stopped getting checked up by a doctor or somebody who could really do something about their condition. So what happened? They become vagrant, and then they suddenly back to the prison. So it becomes a circular issue whereby people who have some kind of a mental illness end up on the streets, end up being picked up by the police, and then the cycle starts again. So when your term in prison ends, suddenly you are on the street, and if there are not enough resources to sustain you on the street or to deal with your mental illness, you are back in prison. How is that working in Texas?
Well, it's very interesting that you bring that up. In fact, just in a few minutes, I'm going to meet with a colleague at the Texas Criminal Justice Coalition. And one of the things that we're really trying to take a look at and dive into the data deeper is looking at those folks that are coming out of state and county prisons or county jails, and looking at those who were homeless before and looking at their chances of becoming homeless again, because we don't want them to be recidivist. So we're looking at how we might address that issue and stop that circle, that cycle, if you will, that you're talking about.
Yes, I appreciate that very much. I appreciate that very much. According to one source I have here, 75% of the female detainees in Chicago suffer from mental disease. Mental disease, 75%. Anyhow, the third category is drug and alcohol abuse. It's almost scary, to be honest with you. And you see people openly shooting up. And it's very, very disturbing. And the last, domestic abuse. This is one of the primary causes of women homelessness. And sometimes women with children homelessness, because the abuse is so rampant in their household. So these are the 4 categories. Now, what is also disturbing is that many of the states have different level of homelessness, and they are dealing with it differentially. For example, according to the data that I have, New York City has the highest number of homeless people, followed by Los Angeles. Now, the difference between the two is, in New York City, they have a law that consider the homeless entitled to having a place to stay, and many of them are housed in hotels in New York City. In Los Angeles, we send them to shelters, and there is nowhere near enough shelters for all the homeless, so they end up sleeping on the streets. But we don't have the similar law as New York. Boston does, but we don't have a similar law as New York. Followed by Seattle, San Diego, Washington, D.C., San Francisco, where the level of degradation in San Francisco is really unbelievable. Even the president talked about it. San Jose, Boston, and Las Vegas. In Las Vegas, half are mentally ill or domestically abused in Las Vegas. And then Philadelphia. And so the point here is, what are the causes of homelessness? We already talked about that a little bit. The number one cause, it seems to me, based on the research I have done, I'm a professor by trade, so I do research all the time, is the lack of affordable housing.
That's it.
Is that
Yeah.
you think that is the primary
That's it.
cause?
There's a Zillow study that I like to, Zillow, the website you can go on and look for homes or apartments. They commissioned a study that looked into this, and they found that as rent approaches 32%, 33% of someone's AMI, then homelessness in that community does increase.
Yes.
Obviously, housing affordability and homelessness, they're directly linked. All other factors notwithstanding.
The median cost of a home in Los Angeles area is $400,000. And many people are spending, especially the lower income people, are spending as much as 50% on rent. Now, if you spend 50% on your rent, say you say you make $100. Let's say 20% go to taxes and all of the other thing, and some to insurance, and 50% go to taxes. You barely have enough money to eat. And you end up yeah. Please go ahead.
What's scary is that when you look at the top 10 occupations that are growing, the fastest growing occupations, 7 of those, they don't make enough to be housed in most of our communities under that AMI percentage that I cited earlier. So if we don't change the housing affordability, if we don't increase affordable housing options, then we're going to be in this boat. And so that's what we're really working on, is trying to increase that deeply affordable housing.
Unemployment is a cause. Many people go unemployed, usually just simply, although they could receive unemployment benefit, but that period is very, poverty in general is a cause, okay? If you are poor and you have a little job that sustains you and suddenly you lose it, we have a problem. Low wages. Do you support, for example, what we call right now a living wage, like $15 an hour? Do you think that will help in your fight against homelessness?
Well, obviously, I think a living wage would help, but how about we create mixed housing, mixed income housing, so that living wage doesn't have to be so high? Because if you get a living wage too high, then that's going to affect the employers.
Of course.
Because they have a limit in what they can offer their staff, and they don't have, it's not limitless. They need to be able to afford this for their businesses as well. So we have to factor in everything, I think.
Substance abuse. Substance abuse is the second, is one of the important causes of homelessness. And what is amazing to me, with all frankness, Eric, is the police know that these people are using drugs. Some of them are shooting openly. And why aren't all those people given only 2 choices? You have to get off the street, and you have 2 choices. One is go to prison because you are violating the law, or go into a rehab. That's it. These are the only 2 choices. Why can't we do that? Could you tell me why, please?
Well, in a lot of communities, you have another choice. You can go into housing. Housing first is what we call it. And while in housing, you can be offered that support to work on that issue. And that is working in a lot of our communities. It seems, if you haven't worked in this line of work, it seems crazy, but it actually does really work, and it's very effective. Housing first model is effective on getting those chronically homeless people who abuse substances off the street and keeping them off the street.
Are these houses that you put them in, do they allow for any drug use or alcohol abuse?
Well, housing first does mean that a person goes in with those issues, if they're dealing with those issues. But I will say it does not mean that the tenant can do whatever they want. They still have to abide by any lease agreement that anyone else would have to abide by.
I see. Okay, and now you have had some success in Texas. I've read something that says basically you've done a reasonably good job in reducing homelessness in Texas. It is rising in Los Angeles and in San Francisco and New York. What have you done that was unique, or is the economy helping you? Given Texas economy is doing extremely well and people are at work, and was that enough, or did you do anything specific as a coordinator of all of these programs for homelessness that helped the situation?
So I would say, over the past 10 years, we've reduced homelessness by 30%, and that's great. Unfortunately, though, since 2016, homelessness has increased by 12%. So it's starting to tick back up, and we're trying to keep an eye on that and identify why that is happening. I do think the economy has helped us not to have a larger increase than we've had. But I think the reason that we've made big strides in ending homelessness and ending veteran homelessness in those poor communities is because we are putting more permanent supportive housing in place. We are doing a better job of working with landlords. We are employing housing subsidies at a much greater rate, and really doing a better job of focusing on the priorities within our communities using data, using objective data, instead of the subjective measures that we have used in the past. And I think those have contributed. I think, unfortunately, we may have reached the limit in what we can do, and so we need to have greater capacity to move people out of the homeless crisis response system.
Now, the subsidies you mentioned, Eric, are these subsidies provided by the federal government or by all levels of government?
Well, so all levels of government can provide it. The majority do come from the federal government. When you talk to your VA representative later on, you can ask that person about, they have what they call VASH vouchers. They're VA supportive housing vouchers. And we've really used those to help reduce the number of veterans experiencing homelessness. But you can also have communities that come together and fund voucher programs so they can subsidize housing and make that housing affordable for that person who may just be getting back into the workforce or maybe getting benefits like SSDI. So there's a lot of ways to go about it.
One last question, if I may. There have been a huge problem with refugees all over the world. Let's talk about the Syrian refugees as one example. Now they have a huge compounds for them in Jordan and in Lebanon. And I think it was an engineer from Denmark who came up with the way to build shelters for them. Basically minimum housing, basically a bathroom and a place to sleep. And I think the United Nations has been rather effective. I'm a big critic of the United Nations on many levels, but have been rather effective in getting those houses installed very quickly and very efficiently. Are we considering something similar to that?
So there's a couple of things. There are a few communities that have what they call tiny home projects, and they are literally little homes. We're talking 250 or less square feet, and they're exactly what you're talking about. And those are popping up around the state, and those do help. They're not the one solution that's going to get us to zero, but they certainly do help. There are other solutions that I think we need to look into more. There's a program called Rapido, and I'm sorry, it's an acronym, RAPIDO. I forgot exactly what it stands for, but it's being quoted as something that we can use, especially along our Gulf Coast, after a hurricane, after disasters. And it's a way for a household to start out with a smaller home and then build upon it as they're able to. So it's a really unique concept that I think could be deployed across the state. It's something we need to look into for sure. One of the things that it would require is for communities to loosen their local building codes in some cases to make sure, or to allow those types of houses to come in.
Eric, it's been a great interview. I'm very grateful to you. You're a very well-informed person. And all I could say right now is God bless you, and hopefully you'll be 10 times more effective than you are already. And we look forward to a conversation perhaps in the near future.
I would like that, and I appreciate you shining a light on this issue, Dr. Joe.
It's my pleasure. This is The Conservative Edge. I'm Dr. Joe Corey. Listen to segment 2, where we actually talk to homeless people who are on the streets here in Riverside or in Los Angeles, and we'll see what their view is of homelessness, and if in fact their homelessness has provided them an input for improving their lives or has depressed them completely. But we'll talk to them and we'll let you hear their stories. Thank you very much. This is The Conservative Edge.